the home manager and this is Ruth. She's the HR. Together, we're going to be conducting your interview today. Are you alright with that? So, Ruth is going to ask you some general questions and then I'll ask you the nursing questions. Is that alright? Okay. I'm going to let Ruth start you off. Alright? Okay, Scholar, tell me about yourself. My name is Scholastica, but everyone calls me Scholar. I graduated from State School of Nursing Warri in Delta State, Nigeria. During my time in nursing school, I won the Florence Nightingale Award and I was also opportune to serve in the SUG as the health minister. After my nursing program, I went on for my midwifery in UBTH, University of Benin Teaching Hospital, also in Nigeria. I've been a nurse for the past 9 years now, and during this time, I've worked in the medical wards, the surgical centers. I've also worked in the geriatric unit. I really loved working with the elderly, and that is what I've been doing for the past 2 years. So, Scholar, why do you want to work as a nurse in the UK? The UK's healthcare system is one of the best in the world. Relocating to the UK is going to help me achieve my career goals. There are endless opportunities that I can take advantage of. For example, I want to further my education, but earning my BSc degree back here in Nigeria is going to cost me an additional 4 years. Whereas if I do the same BSc program in the UK, it's going to cost me just 1 year and I will get my BSc degree. Apart from that, working as a nurse in the UK is also going to give me an opportunity to develop my nursing skills because I'll be exposed to different situations, different environments, so I will also be able to learn how to use major medical equipment that are not available in Nigeria. Also, the remuneration and standard of life in the UK is also another reason why I want to work as a nurse in the UK. Why do you see yourself in the next 3 to 5 years? If I get this job, and I hope I do, in the next 3 to 5 years, I see myself still working with the company but in a higher position. I'd like to further my education, get my master's, and be able to practice as a nurse in a more efficient way. What would you say is your biggest strength and your biggest weakness? I'm a great team player. I try my best to communicate effectively with my team to ensure that everyone is being carried along so that at the end of the day, we can all provide the best care to our patients. I would say my biggest weakness is that I can be a perfectionist. I want to make sure that everything is done properly, so I end up working past my usual hours. However, I'm working on ways to manage my time more effectively and also ensure maximum productivity at the end of the day. So, Scholar, you've been doing great so far. I'm going to ask you the nursing questions in the interview now, okay? So what would you do if you accidentally administer the wrong tablet to a resident? As a nurse, I try to reduce the possibility of that happening by following the 5 rights of drug administration. But if peradventure that happens, my first priority would be to make sure that the resident is safe. I will continue monitoring the vital signs closely. Then I will call the GP for advice and also call the ambulance service if necessary. Then I will inform my manager and write an incident report about what happened. Afterwards, I will learn from my actions, try to find out what happened so that I won't repeat the same mistake. What would you do if a resident falls down? If my attention is being called out to a resident that has fallen, the first thing I want to do is carry out a full head-to-toe assessment to rule out any injuries or fracture. If I find any injuries on the resident, then I will assess to see the extent of the injury and apply a dressing on. If there are any fractures or suspected fracture, I will leave the resident on the floor, then call the ambulance service to come and take the resident to hospital. While we are waiting for the ambulance service to come up, I will make sure that the resident is not left alone. We'll continue monitoring the vital signs closely, reassuring the resident and also inform the family of what is going on. Then I will also ask how and why the resident fell so as to prevent reoccurrence. Then I will inform the manager of what happened and also document according to the home policies. So, Scholar, tell me, how will you prevent your residents from developing a pressure ulcer? I will assess each resident to know those that are at risk of developing pressure ulcers. Then I will put measures in place to prevent that from happening. For example, repositioning them 2 hourly or more, ensuring that incontinence care is being carried out properly and that barrier creams are being used as prescribed. I will also ensure that they are getting adequate diets to promote skin integrity and that their skin has been checked during each hygiene round and any deterioration is escalated as soon as possible. What will you do if you see a fellow colleague or care assistant abusing a resident? I will stop the abuse right away and take the residents away from that environment or situation. I will make sure that they are safe and reassured. Then I will report to my manager and document the event. Scholar, can you tell me what you would do if a resident starts choking while they are eating their meals? I will encourage him to cough so that the food can be dislodged. What if they are unable to cough? I will give 5 back slaps and abdominal thrust. How exactly? How do you do this maneuver that you're talking about? I will use the heel of my hand to hit between the shoulder blades 5 times so that the food or whatever he's choking on can be dislodged. If that does not work, then I will do abdominal thrust. I will stand behind the resident and wrap my arms around their waist and clench one fist, then place it above the navel and put the other hand on top of it and push sharply inwards and upwards until the food gets dislodged. And while I'm doing that, if they become unconscious, then I will start CPR and send someone to call 999 or the ambulance service to take the resident to the hospital. Okay, Scholar, do you have any questions for us? Do you have opportunities for career development? Yes, we do. We organize trainings for our staffs to keep them up to date with current practices. Some of these trainings give them certificates at the end of the program. And there are also managerial posts within the company that they can apply to, but of course they have to interview with everyone else for those jobs. Can I choose a preferred location? Oh, yes, you can. We have homes all over the UK, so we'll take your preferences into consideration. Is that all right with you? Okay, Scholar, thank you so much for your time. Your agency will let you know how the interview went today, okay? All right, now, bye-bye. Bye. Thank you so much for this opportunity. I really look forward to being a part of your team. Thank you so much. Bye. Okay, thank you. Bye. Okay, my viewers, if you enjoyed this interview session, if you've learned something, please encourage me by hitting the subscribe button below. It's just under this video. Give me a thumbs up and hit the notification bell. And thank you so much to all my returning subscribers. I love you guys. Click this picture here or probably here. Click this picture here to subscribe to my YouTube channel.